We just interviewed one of America's top plastic surgeons.
I really, I always try to push myself to kind of the next level, whether it was, always in school, I wanted to be the best student, the best college student, the best medical school student, the best resident. And actually, even when I took my board certification exam for the American Board of Plastic Surgery, I got the highest score in the country.
Your bio and like everything I'm saying, 99 percentile, top, the best, Vegas's top surgeon 2021. I don't even think I have enough time to read your whole list of awards. It's like covering my
Thank
own
you.
right now.
Thank you.
It is such a pleasure, Dr. Brosious. This is such a great honor for me.
Well, thank you very much. I hope I can live up to all the expectations here, Ashik.
You don't know how much this means to me. Thank you so much for this again.
Yeah, of course. My pleasure.
You're such an incredible guy. I've been following you for years. Just know that I'm probably your biggest fan in South Africa.
Well, thank you so much for the kind words. I'm glad that I'm able to inspire people and I'm not your traditional doctor, certainly not your stereotypical doctor in terms of who I am and what I do. So I'm glad that it's certainly very polarizing who I am. There's people that don't like me because of the surgeries I do. There's people that don't like me because of how I look. But at the end of the day, I always stay true to myself and what I think is the right thing to do. And I sleep well knowing that, I think hopefully I'm leaving the world a better place. So
I know I'm definitely inspired, and I'm sure many of our listeners will be as well.
all right. So my name's John Brosious. I'm a board certified plastic and reconstructive surgeon here in the United States in Las Vegas, to be exact. I've been out in practice for 11 years now. I finished my residency here at the University of Nevada in plastic surgery in 2013. I'm actually from Pennsylvania, the state of Pennsylvania. So after I did my training here in Las Vegas, I did practice in Pittsburgh. I was affiliated with the University of Pittsburgh for a couple of years. And then my mentor, the person who trained me in plastic surgery, he passed away. He was the program director for my training program in Nevada, and he passed away in 2015. So actually in 2016, I moved back to Las Vegas, and I was a professor at the University of Nevada, and I was actually the program director for the residency training program. I did that for maybe about 3 years until I opened up my own practice. Me and one of the other professors at the university, we left the university and started our own private practice about 2 years ago. And that's when I started doing the social media thing. I never had any social media, no Instagram, Facebook, anything like that. And then I went out into private practice and we had a marketing team, and our marketing team was like, you have to, you of all people have to be on social media. I mean, you're a unique person, you do unique things, and just being a plastic surgeon in America, you almost have to have some presence. I do the whole spectrum of plastic surgery, head to toe, cosmetic and reconstruction. On the cosmetic side, I think I did 3 facelifts in the last month. I have a gynecomastia surgery tomorrow. I do a lot of abdominoplasty and, your basic cosmetic surgery. But my true passion and what I basically came out of the gate doing was reconstructive surgery. One of the best parts about plastic surgery is that you're, not to bash the general surgeons, but we're the true general surgeons, right? So we operate head to toe on any type of tissue, any body part. And so to me, that's what drew me towards plastic surgery. And the reconstructive side, it's really creative. It's the most, in my opinion, most creative specialty in that no two patients are going to have the same problem, same defect, whether it's a trauma defect, a cancer defect. It's kind of a very pure specialty in that regard, is that, it's really easy to identify the problem in plastic surgery. Somebody's missing an arm or a piece of their face or their nose or their breast. It's not like a diagnostic dilemma really to be a plastic surgeon. It's more or less, a reconstructive problem. So I started doing reconstructive surgery, microsurgery, and that includes, and when people talk about microsurgery, basically that means connecting microscopic blood vessels in plastic surgery. So that's, reattaching fingers, reattaching arms, doing auto transplants. So I do a lot of breast reconstruction where we take abdominal tissue and rebuild it into a breast, but to provide circulation, we're connecting, 1 to 2 millimeter blood vessels under a microscope. So I do a lot of microsurgery, head and neck cancer reconstruction, breast cancer reconstruction, lower extremity reconstruction after trauma, abdominal wall, hernias, burns, of course, and then your basic, cancer reconstructions and skin cancers and that kind of thing. And my real niche now, for the last maybe 6 or 7 years, has been transgender surgery or gender surgery, which is
how did you get into it? In fact, even in South Africa, I know maybe 2 gender surgeons of the whole country. It's a very niche field. What drew you to that?
Yeah, so everybody always asks me this because there's only a handful of us really in the country that are even doing the genital surgery. So it's kind of a funny story. I never had, I had no experience in my residency and in medical school. There was no talking about gender surgery. There was no talking about genital reconstructions, any of this. This was really not a part of mainstream plastic surgery. Insurance was not paying for those types of operations during my training, during my early career. And so, the transgender community is a pretty discriminated community. I'm sure it's not much different in South Africa.
Exactly the same. It's true. Mm.
Yeah, so those patients couldn't even afford the surgery. So it really wasn't, from an educational standpoint, there wasn't a whole lot of need to teach this because there's no market for it, right? Nobody was doing this. The patients couldn't afford it. Um, and so I didn't have any exposure to it whatsoever. And I grew up in a very religious household and in a Catholic family. I went to Catholic school, grade school, high school, college. So I didn't even interact with, transgender people throughout my life, Ashik, which is something that everybody's really surprised when I tell them that I grew up in a religious household and never
Yeah.
met, really new transgender people. So it kind of just fell into my lap, being a gender surgeon. So, like I said earlier, I got this reputation when I went out into practice that I would do anything head to toe. And so a lot of the other surgeons that didn't want to take on, kind of crazier cases, harder cases, revisions and redos, they knew that I would probably say yes. The patients and the other surgeons around Pittsburgh knew that Dr. Brosious will probably say yes because, he likes to take on some of the more challenging things.
It like fits into your personality. You seem like someone who would take on any challenge though, because you
Yeah.
like in terms of breaking the boundaries of a typical plastic surgeon, you're an ideal example of that.
I really, I always try to push myself to kind of the next level, whether it was, always in school, I wanted to be the best student, the best college student, the best medical school student, the best resident. And actually, even when I took my board certification exam for the American Board of Plastic Surgery, I got the highest score in the country.
I can see
My
that. Everything I'm seeing, 99 percentile, top, the best. Vegas's top surgeon 2021. I don't even think I have enough time to read your whole list of awards. It's like covering my
Thank
own
you.
screen right now.
Thank you. Um, so yeah, so I always felt like I like the breadth of plastic surgery. I like that I didn't want to specialize. I didn't even do additional training after my plastics residency. A lot of people will do hand surgery or microsurgery. My partner in my practice did craniofacial and microsurgery, but I liked everything.
Right.
And I wanted to excel at everything. And
Mm.
so that's how I got this reputation where, hey, like if it's a tough case, maybe Dr. Brocious will take it on if it's reasonable. So I started getting phone calls from transgender patients. Now, this was in Pittsburgh, mind you, probably 2014, 2015. And they were saying, "Hey, would you be willing to do my chest surgery?" And I had never done it before. I'd never even really heard about it. And so I did a little bit of research and I said, okay, this is basically breast augmentation and mastectomies to masculinize the chest. I said, well, I've been doing breast reductions my whole life, breast augmentation, cancer reconstruction, gynecomastia. Really, chest surgery is kind of in my wheelhouse. So
Mm.
I told the patients, come on in. Let me see what I can do to help you. So I'll never forget my first patient. She was a transgender woman, very clearly transgender, had a big frame. And she came in and I did the consultation with her for breast augmentation. And at the end of the consultation, she started to cry basically. And I thought for sure, I had misgendered her or, I thought I offended her in some way. So basically, I said to her, look, I'm really sorry. If this is my first time having a consult with a trans patient, if I said something, if I slipped up, please let me know so I can improve. And she said, no, the reason I'm crying is I'm happy you're the first doctor in the whole city of Pittsburgh that didn't shoo me out of the office immediately and that treated me, respectfully and like a human being.
That's
So
inspiring.
yeah, I want to move a little bit out of here just because one of our dogs is over here barking.
Oh, sure, sure, no
Um,
worries. Do
I'll
you have,
find
I
another
didn't know
room
you
here
had
to.
dogs though. Yes.
Yeah, so I got married recently, and my wife.
Congratulations for that, by the way.
Thank you, thank you. My wife is from Poland, and we shipped her three Polish dogs over here about 6 months ago. So, all
How
right,
how did you both meet? Because I believe she's a nurse, yes, and you both
yeah,
have a clear love of tattoos as well and art.
yeah. So she's a nurse from Poland, and basically we became friends over social media, and for a long time, and just because of I don't know any other people in healthcare who have tattoos like I do, whether a nurse or a doctor, and so we kind of became friends and decided we were going to meet. And so yeah, in December, I flew to Poland to meet her for the first time, and Met her in December.
Thing.
She decided to move to America in February, and we were married in March. So, um,
Congratulations. I
so
couldn't be
thank you,
happier.
thank you. Yeah,
And that's
pretty
inspiring.
wild story.
It's
Um,
inspiring.
yeah, thank you. And we can get into that a little bit more in a minute here, but let me just finish up on how the
Sure.
transgender thing ended up coming to light. So, after I did this consultation with this woman, I did her surgery. She was the happiest patient, so happy with everything, and the most appreciative patient that I'd ever had. And so that's when this light bulb went off in my head, like, wow, as one surgeon, I can really help out a whole population that's been almost left behind by healthcare.
Mm.
And so that's when, I started getting into more of the gender surgery. Now, back then, insurance was not paying for this. And so the patients had to pay out of pocket. So it was really few and far between, a surgery here, a surgery there. And then if you fast forward to 2016, I moved to Nevada. And then if you're somebody who does transgender surgery, the trans community finds out pretty quick. They're very tight knit, like on social media.
Mm.
So within a few months, the community found me and started coming to my office in droves for chest surgery. And right around this time, insurance started covering this. And without going into all the details, basically, there's been decades of literature talking about, the mental health benefits of these surgeries, the decrease in the self-harm rates, depression scores. Basically, they integrate into society better with these surgeries. And the regret rates being very, very low, usually less than 1% for most of these surgeries. As a matter of fact, for vaginoplasty, which is the genital surgery that I do, that's about a 1 in 300 regret rate. So it's very, 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 very low. But
Mm.
anyway, so I started doing these chest surgeries, and before I know it, the trans patients started to ask me, "Hey, do you do genital surgery?" And I said, "Well, I'd never done it." And I said, "Well, what's going on right now? Who's doing it?" And the patient said, "Well, there's nobody in the state of Nevada where we live, nobody in Las Vegas. There's very few people in the whole country that do it. Most of them don't take out of state insurance, and even if they did, the patients don't want to travel to have these big complicated surgeries out of town if there's an issue or something like that. So they're really kind of stuck."
Mm.
And most of the surgeons in the country have, significant wait lists. For example, mine already is over a year for the genital surgeries.
Wow.
So I told the patients, all right, well, then I'll learn the surgeries, which
Nice.
was no small task. Back then, I started doing these surgeries in 2020. So it took me about a year or two of preparation in terms of traveling. I actually took my own vacation time, my own money. I traveled around the country, observed people do the male to female genital surgeries. I read every article ever published from the 1990s till today to get a grasp of these surgeries. Went to conferences, and then after, about 2 years of doing kind of putting together my own training, piecemealing it together, I decided, okay, I think I'm ready to start offering the service here in Las Vegas. So you'd think that the patients would be a little reluctant to go to somebody who had never done them before, but I'll tell you, Ashik, these patients, they were fighting over who could be first,
I can imagine.
because the way they look at it, it was either me or nothing, right? And so they would much rather have, me do my best than live with the body part that's making them suicidal, that they're ashamed of. And so, yeah, I did the first transgender genital surgery in the state of Nevada in August of 2020. So that's actually 4-year anniversary from this week. Actually, it was when I first
Wow.
started vaginoplasties.
Good
Yeah.
timing.
So
If I could just explore that. So, like, do you find is that an approach you use when you learn any new surgery? Do you go to the best people, you observe them, you read all the literature you can about it, you sort of create your own framework for doing it, and then you execute it. Is that how you approach all new surgeries that you learn?
Kind of. The nice thing about plastic surgery is I always tell my trainees when I was program director, I said, when you're a plastic surgeon, when we graduate you, you're probably responsible for 5,000 different surgeries because there's so many different, from head to toe, every type of reconstruction. And I say of those 5,000 surgeries, you'll probably only see 500 of them during your training. And of those 500, you'll probably do most of them more than once, maybe only 100 of those cases. And so my job as the program director was to teach you anatomy and teach you principles.
Nice.
And the nice thing about plastic surgery is if you know the anatomy and you know the principles, you can apply it to most things.
Nice.
So when I was trying to learn like a new surgery, I did a lot of hand surgery in Pittsburgh, and I was always trying to learn not necessarily a new surgery like a cutting edge thing, but something that I'd never seen in residency. I would ask the medical librarian, hey, can you, pull a couple papers on this? And then I would maybe even observe another hand surgery colleague downtown, do a couple surgeries. But with the gender surgery, it's a lot harder because very few people do this.
Mhm.
And this is a very, as a plastic surgeon, we do operate head to toe, but I didn't operate on the genital system other than maybe congenital deformities, some traumas, skin grafts, but I wasn't disassembling and reassembling the genitals. And
Mm.
so I had to learn all that new anatomy. So when it comes to learning a new surgery or a new type of procedure, most of the time I can kind of do it on my own, even without, having to travel. Nowadays with videos, YouTube, and you can reach out to other surgeons and virtually, kind of like we're doing right now, and chat about procedures without having to travel. But for the gender surgery, this is something I had to see, I had to observe, I had to pick the brain of these surgeons, because these surgeries, there's not. I do a lot of limb saving surgeries, but this is really the only life saving surgery I do. These patients are so focused and so relying on this surgery to change their lives that the stakes are very high.
Mm.
And these are pretty difficult operations in terms of the chest surgery, for example. A chest just has to sit there and be a passive structure, right? Has
Mm.
to look nice. The genitals, right? They have to look nice. They have to be functional. They have to, potentially have the ability to have orgasms, have sex.
Mm.
I don't want to interfere with their ability to void their bladder, their bowels without damaging them, making them incontinent.
Mm.
Um, and so there's a lot of high stakes with these genital surgeries. And so I really took my time to kind of learn it. Um, Nowadays, there's actually fellowships where you can do additional training after plastic surgery, but there's only a handful of them in the country. I believe there's 5 right now, and they only take one resident per year. So
What?
if you imagine with the population of the United States, they're only turning out 5 new gender-trained surgeons. And many of those people that do the training, they get into the fellowship and they see how complicated these genital surgeries are. And many of them decide not to do the genital surgeries and say, hey, look, I'll just do chest surgeries, I'll do facial feminization surgeries, but I'm staying away from the bottom surgery because of the complication rates, fighting with the insurance. It's really kind of a nasty thing, even though it's covered by insurance.
Mm.
It's a struggle to get it paid for, especially when you're the first one doing it, in a region and that kind of a thing. Um, but yeah, but these are life-changing operations. I like to say to people that, as a plastic surgeon, I used to do, and I still do a lot of cancer and limb salvage, but I used to tell people if you met me at my job, it was one of the worst days of your life, right? You either got your hand cut off, or you were diagnosed with breast cancer, or you got shot in the face with a gun. And so now when I'm kind of shepherding these trans patients and these non-binary patients through their chest surgeries, their genital surgeries, I'm actually taking them through one of the happiest experiences of their life.
Nice.
So it's pretty interesting. I used to go from a clinic full of, disappointed people who were sad, rightfully so, because they just had a terrible diagnosis of trauma or cancer or something like that. And now, fast forward, I take care of these people, and I'm one of the most important days of their life.
Love that.
So it is really cool. And and so yeah, I never thought I would be, doing gender surgery, but the population and I think what happened is I started tattooing when I was very young, and then started even getting to the visible body parts, even as I was a professor at the University of Nevada, on my throat, on my hands. And everybody was like, Dr. Brosious, I can't believe you're doing this. You're going to ruin your career. And I said, look, I know my patients. They're nonconformists, and they look at me and they say, hey, look, he's a nonconformist. We're nonconformists. We're not going to judge each other. Let's just do this. So, if anything, I think the tattoos have helped me a lot. Get patients, get their confidence, get a better rapport with patients. Many of the patients come in, they say, I'm immediately comfortable with you, which you wouldn't normally expect somebody to say about a doctor with a face tattoo. But they say, you're not going to judge me. And they also say that instills confidence. Like, you're obviously very confident in what you do if you can walk around looking like that, and still have a wait list for surgery.
If I can
Yeah.
explore that, in South Africa in particular, the medical community tends to be very secular. And then, like, especially because they've been so used to traditional ways of thinking and doing things. And what you're doing, like besides your work, even the image that you portray, the tattoos, it shows that like you can be a top surgeon, you can be a top doctor in any, but you can be yourself. And love that you don't
Hmm.
have to conform just because everybody is like that.
Yeah.
That was the first aspect of you, who you are as a person, that inspired me. Like you can do a lot of you don't have to be the typical doctor. You can be whatever you
Mhm.
want and still be an expert at your job. I love that.
Yeah.
That's a great lesson for anyone.
Yeah. And honestly, it just goes to show that, you know, The world is changing, and somebody has to be, the first one. I certainly don't know any other doctors that are as tattooed as me, face, that kind
I
of a
don't.
thing. Um, and so someone's got to be the first. And I felt that, I was well suited for multiple reasons. Number one, I live in Las Vegas, so we're just an open-minded city.
Love Las Vegas.
Everybody has got lots of tattoos.
I was there last year actually in
Oh,
September.
awesome.
Beautiful place. I'd go back in a heartbeat.
Yeah, so it's a very open-minded city, and this is a reason why I think I have so many patients is that a lot of transgender people, as they kind of come out during their social transition, a lot of them leave their old life behind and come to an open-minded city. And so Las Vegas has a huge transgender community. And so, I live in an open-minded city. I take care of people who are, the nonconformists, the trans patients. And I don't have, I mean, now I'm married and so I have sort of a family, but I never had a family with a wife or children. And so many of my colleagues are like, I would never do that because I'm afraid I'd lose my job and I can't support my family. And I'm like, well, I mean, the only person I'm hurting if I lose my job is me since I'm by myself.
Nice.
So, when I started doing all of this transformation of the tattoos and my appearance, I knew that I had a very unique career and in a very unique location that I could probably get away with this.
Mm,
And I also knew that when I started the gender surgery program at UNLV, I was still a professor, and that was something that the UNLV was very proud of, right? I put together all the different specialists required. I grew the program myself. I do the surgeries. I found hormone doctors, mental health professionals, and I basically created this team that UNLV, the university was very proud of. And
mm.
so I knew that there was no way they were going to fire the gender surgeon, right?
Nice.
Especially over a tattoo, right? Because
Yeah.
I'm on the news a lot, and so I think that they were afraid that if you fire me, number one, you're not going to have that service anymore that they were so excited to brag about. But also, I'll just get on the news and be like, can you believe that they got rid of
Discriminating.
their gender surgeon because of a tattoo?
That would be a great loss to them and the entire Nevada community.
Yeah. So I felt that I was kind of uniquely situated to be one of the first people to show that, look, you don't have to look like your traditional doctor. And I don't want to say that it's going to change the world, but I think that the generation right now, the younger generation, even your generation, you know, a lot of them, they don't want to take shit, right? They're
Mm,
not going to take the abuse from the patients,
mm,
from older doctors, from insurance companies. And so I think that you're going to see a lot less people willing to go into healthcare in the younger generation because I hate to say it. I mean, it's rough. Patients don't always treat the doctors like they used to. I don't know what it's like in South Africa. But when I was growing up, almost that like doctors were on a pedestal and you just told whatever they told you, you did it and you listened and you respected them. Nowadays, my patients, especially with the access to Google, everybody thinks they're a doctor. They're questioning you. You've lost your authority a little bit with the patients, and they just don't have the same respect. And at the same time, payments are going down. The hours kind of suck in healthcare. So I think you're going to see a shift of people not wanting to go into healthcare. And so pretty soon, you're not going to have the choice to be picky about what your nurse or your doctor looks like. You're just going to be happy that you have somebody. And so I think that we're kind of at that tipping point where I'm seeing it at hospitals all over, here in Nevada, is that they used to have policies. You had to cover this, you had to cover that, you had to cover your tattoos. And now a lot of them are shifting away from that because they can't find staff.
mm.
If they start to have these draconian rules that you got to cover your little tiny wrist tattoo, I think that you're not going to have people working. And in a way, as healthcare workers, like I've said before, it kind of it's a great icebreaker to talk about tattoos. People don't associate it as much with biker gangs and drug dealers and cartel anymore like they used to. And so, if I had a swastika or something offensive on my face, that's a different story. But the way I look at my tattoos, they're all very large, colorful, beautiful tattoos. It's not like I was in prison, that kind of a thing. And even if they did look, black like prison work, again, it's not about the appearance anymore. People have to kind of get past that, that's just the old expression, don't judge a book by its cover, right? And I hope that I'm a living example of that. I know that my wife is as well. And she said she's experienced a lot of the same things. This is kind of how we bonded, right? And in Poland, she's been an OR nurse for 18 years and slowly collecting these tattoos over the years. But she was so good at what she did. She was in the same department for 18 years, knew everybody. She knew that she could get away with this because she knew everyone in the hospital. She was good at what she did, and she's really has a heart of gold. And so she knew that she would be well protected. and that people, they may kind of roll their eyes when she comes in with a new face tattoo or a neck tattoo. But at the end of the day, she was good with the patients, she was good with the doctors, and they needed her. And so she knew that she could get away with it just like I can. And she was brave enough to just be herself and not let, her whole life go past and then look back and say, gosh, I wish I would have been more like myself. I wish I would have done more things to kind of make me happy. Um, so I'm hoping that, it encourages more people to go into healthcare, to express themselves a little bit better, or people that thought that maybe, I don't want to go into healthcare because of this rigid idea of what a doctor has to look like. Maybe I want to have piercings and tattoos and different attire. And like you said, South Africa is probably very similar to the United States. It's still
It is.
that old school
Conservative.
mentality.
Yeah.
It's one of the few professions where you have to have a certain look, otherwise people will judge you. But like I said earlier, I think because people are, I think the younger generation is going to stay, probably stay out of healthcare if things don't change. I don't think we can be picky. And so that's why I think that you're going to see more people in healthcare. And I actually have a talk with a lot of other people about face tattoos in particular. And like in the corporate world, you just don't see it.
Hmm.
Unless you were like a celebrity or something like that, you don't see CEOs, you don't see accountants, you don't see a lot of corporate salespeople with the tattooing. And I think that's still, it hasn't, broken into that field yet. And I think largely because there's still so many people, there's 10 people that could fill any job, right? Where they don't need as much education as experience to be good at what they do. Whereas, doctors and nurses, you go through school, such a long school, you're not going to have your pick of so many different people to fill your jobs, and especially if the younger generation doesn't want to do this work, you're going to be happy to have whoever that you
Exactly.
get, whether they have a tattoo or not. So
The first,
that's
I'll tell you, because I remember telling my twin brother this as well. The first time I saw one of your pictures on social media, my first impression was, wow, this is awesome. Like I've never seen this before. And do you find with the younger crowd, they're more inclusive than the previous generation, especially when it comes to how you express yourself?
Oh yeah, absolutely. I think that, the younger crowd for sure, they're more accepting of body modifications, tattooing, that kind of a thing. All the medical students, I would say, many of the medical students and residents I worked with, they had tattoos, whereas even just 15 years ago when I was a resident, you just never saw it. I had a sleeve tattoo during my end of my residency, but I used to wear, a neoprene or, some type of cloth sleeve over it when I was in scrubs, so the patients never saw it. And then when they were asleep, I'd take it off, scrub, do my surgery, and then immediately put it right back on.
Hmm.
And nowadays, people are very proudly showing their tattoos. So I think that, they're more inclusive in terms of how you present yourself, your appearance, and also more inclusive of just humanity in general, whether that's LGBTQ, minorities, that kind of a thing. Here in the United States, if you looked at, and most people with common sense would realize that there's not more trans people now than there was before, internally at least.
Hmm.
There's always been trans people, but they've been afraid to be themselves. They've been afraid to come out, right?
For
And
sure.
so it used to be, 1% or less of the population identified as transgender decades ago. Whereas you fast forward to today, and depending on what study you read or what survey, we're looking at 3% or higher people identifying on the gender expansive community.
Hmm.
And so they probably always existed like this, but they just were afraid to be themselves.
Hmm.
And so we're seeing the younger generation, they're a lot more accepting of those type of people, and particularly of the surgeries that I do then. It's very polarizing, the surgeries that I do. For me, it's science. I never once thought about, this is even controversial, right? When the patient started coming to me, as all I looked at is, hey, this patient has a problem. I looked up the international guidelines. Okay, this is how long they have to live, as a woman to be eligible for surgery. This is the surgery. To me, it was just healthcare like anything else.
Nice.
It wasn't actually until, election cycles, things get very politicized in the United States.
Hmm.
I'm not sure if you see a lot of that,
I do.
abroad,
We follow it
um,
immensely.
but
Even
but
here.
oh my gosh. Immediately, during the 2016 election, and again 2020, and now again 2024, I get these like ebbs and flows of people who are critical of what I do.
Hmm.
And at the end of the day, I'm the expert in it, and I can pull statistics out from studies, and so people don't argue it with me in terms of whether or not this is medically necessary, in terms of whether or not this actually improves people's quality of life. what they want to argue with me is something more abstract, the religious aspect of it,
Okay.
the social aspect of it. And I'm like, look, I'm not religious. I grew up Catholic. Very, like I said, I was an altar boy, Catholic school, all the way through college. I went to the University of Notre Dame. And as I started getting older, I became less religious as the scientist in me kind of developed as a doctor.
Interesting.
And but one thing that I always took is that, I I learned as a Catholic, treat the marginalized, treat the poor, treat the underprivileged, take care of those who have less than you.
And that's
And
exactly
so
what you're
that,
doing.
I like to think I kept that value from my childhood, from my upbringing in Christianity. And I think that's the most important thing is that I'm taking care of a discriminated population. And I think if any Christian would say that Jesus would want to do the same, maybe they don't agree with it, but this is my way of really, taking care of as a surgeon. I didn't think as a plastic surgeon I'd be serving a huge marginalized community. But like I said, this light bulb went off in my head many years ago that's like, hey, wow, I can actually some of those good values that I kept from my upbringing, I could actually, apply those to what I'm doing in my practice. And, I think that 10, 20 years from now, we'll look back and we'll laugh about, hopefully we'll laugh about how people were critical of the surgeries that I've done as they become more and more mainstream. But all it takes is just, if you look at any of the YouTube videos I've done or any of my social media,
I think I've seen all
there's
of
a
it.
lot of people out there that don't like what I'm doing.
But
And when they can't argue the science, they like to argue the religious aspect of it. And that's when I say, hey, look, I'm not religious, so I'm not going to argue what God would want or not.
but I think I
I'm
think
just here to
that's
help people.
I think that's but that's a good lesson in like in general. Whenever you break boundaries, like throughout history, whenever you've broken new ground, you've explored a new area, you'll always get people who are afraid of change. I mean,
Hmm.
that's to be expected. But your results speak for themselves. I just looking at the reviews, I can see countless positive feedback from all the patients whose lives you've changed, and that's
Hmm.
quite metaphorical. That plastic surgery, like you see it mostly as reconstructive and like of the body of the anatomy, but you're sort of reconstructing people's souls and livelihoods with your
Yeah.
work. I mean, that's um, like not many surgeons can do that. You know.
No. The emotional component to the surgeries that I do, I mean, it's the whole reason I'm doing these surgeries because a lot of people are critical and they say, I can't believe you're operating on perfectly good body parts and you're taking away perfectly good body parts and you're changing the genitals of perfectly good, no pathology at all. And I say, yeah, but this is, gender surgery. It's really the only, gender dysphoria or the unhappiness with your body. It's the only psychiatric condition that's treated with surgery. And this has been borne out in the literature.
Look at it.
And a lot of people, don't are it's hard for them to accept that. But most of those people, they've never met a transgender person. And so all it takes is, spend a day with a trans person or just listen to their story, and then you realize nobody would choose this life. I mean, this is a life that is a very hard life for almost all of them. And so nobody would choose it. And so this isn't like they're coming to me because they're doing something it's a fetish for them or something like that. This is their identity. And like you said, as a plastic surgeon, usually you can help people, emotionally with reconstruction or doing a nose job or a breast augmentation. Certainly you can help out their emotional state, but that's not life-saving. And these surgeries that I do, I mean, I have a patient hug me once every 2 weeks probably and say, you saved my life, Dr. Brocious. And
That's incredible.
yeah, and I never thought as a plastic surgeon I would hear that. I thought I'd hear them say, thanks for saving my finger and my leg, or rebuilding me. But I never thought as a plastic surgeon that I would be performing on a regular basis life-saving surgeries, basically. If you think about here in the United States, the suicide rate, the suicide attempt rate is about 40% for a trans person.
Mm.
So that means almost half of trans people are attempting or committing suicide during their life. I mean, this is really an emotionally tough population. And so these surgeries, like it gets to the core of who they are. It's their identity, right?
Mm.
Sure, a nose job, a facelift, a tummy tuck. Yeah, it's how you view yourself. But nothing that I'm aware of in plastic surgery has the same impact of who you are as a person as gender surgery, and that's how people define themselves. And so, um, yeah, I never thought I would be saving lives as a plastic surgeon, but I'll tell you, that's what keeps motivating me to keep going. Even when I see bad comments or I have family members that are critical because of their religious views, it keeps me motivated. that the patients keep coming back and they're happy and that I've changed their life for the better. And I know at the end of the day, I sleep well at night knowing that I'm doing the good thing, a good thing. And I know that, in the future when I'm on my deathbed, I'll look back and say, hey, you know what? It wasn't an easy road, but I did what was right and I stayed true to myself the whole time. And I'm not gonna have any regrets for what I did. So
I love that. I think that's one of the greatest lessons we can all hope to learn in medicine. You're a rock star in the field. You spend so much time doing these amazing surgeries. Say, what does an average day in the life look like for you? So let's say you go in. I've seen some of your videos of a day in your life. I was like, what does it look like? I'm curious.
so now things are a little bit different now that I'm married. It's been but before that, and this is what I tell a lot of the younger generation because I see a lot of younger students, trainees that are interested in gender surgery, which I think is a great thing. The problem is especially if you're going to be doing the genital surgeries, you're kind of on an island. And so I have a partner in my practice, but he doesn't do the genital surgeries that I do. I don't know anybody, sort of, closer than Los Angeles that does. So I have to be available 24/7, 365 for my patients.
Wow. Okay.
So I don't go out, I don't drink, I sleep by my phone, I'm by my phone 24/7. I keep it next to me in the shower. If I have a patient who had a vaginal reconstruction and they're bleeding because they have to, do all sorts of medical treatments to keep this canal open, bleeding can be an issue, infections, scarring. They're calling me, and this is a very intimate surgery where these patients are freaking out sometimes if things aren't going smoothly. So they're calling me at all days, all night, weekends, especially Saturday night, they love to call me. And so from a quality of life, it definitely owns who I am. I don't drink. I don't go out. I hardly ever leave town. I leave town usually 1 week out of every year, and I make sure that I don't do any big surgeries like leading up to that so that I can kind of feel good about not being available. And so it kind of owns my life in that regard, in that I can't just like, turn my phone off and tell my partner, hey, cover me for the weekend. If one of my patients calls and they're having an issue, he forwards it to me, and that's my problem.
Mm,
And
that's the
so in a way, and it kind of owns my life like that. I think I will search and probably find a partner at some point who does these surgeries, or one of the trainees that I teach will hopefully join me, and that way we can kind of share the call burden.
mm,
But as of right now, I mean, that's my life kind of revolves around these surgeries that I do. But again, I still have I've made it a point to have some type of balance in my life.
right.
So fitness has always been a big thing for me. So yeah, my typical day, I'll get up. I'm a very much a man of routines, and I think that's what's helped me be successful throughout my life is that I almost do the same thing every day. So I wake up every morning, I have the same breakfast. I have 2 carrots raw,
Mm,
quarter head of broccoli raw, and 2 celery sticks raw. Every
nice.
morning, for probably 7 or 8 years now. It's the worst, most disgusting breakfast anyone can imagine, and everyone's like, "How do you do that?"
I should try it.
Um,
I love
but
broccoli and celery and carrots.
it starts off my day. If I have like a very healthy all vegetable breakfast, raw veggies right out of the gate, I feel like I'm already starting my day off on the right foot. And if I eat garbage later in the day, at least I did the one good thing for my body.
Love it.
So, so every morning I eat my raw vegetables. I go to surgery or clinic, whatever it is, till the afternoon, whatever time I'm done, and then I work out. I'm religious about my training. I've always been into athletics. I played sports in high school and got into fitness, and so I don't participate in competitive sports anymore, aside from occasional marathon or half marathon.
Nice.
But even I'm not doing full marathons anymore. But I love to exercise. So I have the same routine. I work out 2 days, then I take the third day off. 2 days on, one day off. So it doesn't matter if I get home at 11 p.m. If it's my day for the gym, I go to the gym. I
Wow.
run 5 miles, which would be about 8 kilometers, and I lift weights for about 45 minutes. And I've been doing that religiously since I was, 18 years old, probably.
Amazing.
Yeah, so about 40 kilometers every week I run at 25 miles, and I've been doing that religiously. I used to run more like long distance, full marathons, and then I kind of hurt my knee a little bit during a full marathon in Pittsburgh, and so now I won't do more than like a half, and even that I don't like to do. But I still do my 25 miles of running a week to kind of make sure that I'm in good physical shape, as well as resistance training. So that's something that always clears my mind. Everyone's like, why do you want to go home and run 5 miles? And I'm like, it's not that I enjoy the running, but it clears my mind. When I'm lifting weights, when I'm running, that hour and a half, it clears my mind. It helps me think about something else. And so that's been a big hobby of mine and a huge part of my life, my whole life, through residency, medical school, I would come off these 30-hour shifts in residency and I would go right to the gym. I'm like, I got to get my workout in.
Oh,
Um,
I need
and
to be one of
so,
those. Seriously.
yeah, I would never skip. Only when, I take about a week or two off a year just to kind of like let my body heal. But other than that, I'm always working out. And then tattooing. And so that's, to me, that's like a number one, a hobby of mine, a passion. And it is kind of like therapy in a way. And nobody likes getting a tattoo. Anybody that says they enjoy getting a tattoo, they're lying. It hurts. It freaking hurts, man. I actually did yesterday. I redid my neck, all this purple here, and so
That's
it's a little
pretty
swollen today.
nice.
Um,
Yeah,
but
but
I go
what was your first tattoo? Do you remember that? Was there
My oh yeah, yeah. My first tattoo is classic. I was 18 at the University of Notre Dame, and I got my cross tattoo on my shoulder right
nice,
there.
nice one.
So, yeah, 1999, 2000. So that was, a cross on a shoulder is about as, generic as it gets. But that's most people, and it was on the wall. I pointed to the one on the wall. That's the one I want. $100
Nice.
back in the 90s. And so and it started with that, and that started the addiction. Now I couldn't afford a lot of these tattoos. In medical school, I would get small ones here and there. Residency, the same thing. It wasn't until in residency I did get a full sleeve, but it wasn't until I graduated and had more money that I could, really start working on my bodysuit. And that's, really my goal is to have my whole body tattooed.
Nice.
Um, and so I'm probably only about a year and a half away from that. But the tattooing. Number one, it does so many things for me. The self-expression, I think that's huge. That's huge for me personally, how I view myself. I think it's great for my career. I think the patients actually enjoy that. It's great as a teacher, as an educator, because you should see that I still give lectures. I'm a volunteer faculty at the university, so I give lectures every year to the medical students on gender surgery,
Nice.
and to the interest groups. And I love getting up on the podium and everybody's looking at me like, oh my God, that guy's our professor. Um,
I love it.
and so I think it's inspiring to a lot of the younger generation that, hey, look, you don't have to look like your average doctor and you can do good work. And so I think in a way it's good for me professionally, but also therapeutic in sense of, as I'm getting my neck tattooed yesterday, my chin, it was so painful that I'm not thinking about work. I'm not thinking about my accounting. I'm not thinking about paying my office staff for the week. I'm just thinking about getting through this tattoo session. And so it clears my brain. And it may be a little bit of a masochistic way of doing it. But literally, I am not thinking of anything else other than squeezing my, fists tightly and clenching my jaw and just trying to get through this session. And so in a way, it's cathartic. And so that's like my version of therapy. Everybody has their own versions of therapy. And for me, it's basically, tattooing.
Two more questions, Dr. Brosious.
Sure.
Firstly, how do you see plastic surgery changing in the future? I know you're one of the trailblazers. You're changing things as it is. Like in the next 5, 10 years, where do you think you see the field going with amazing talent such as yourself?
Yeah, so I think for sure, in my area of expertise, gender surgery, for sure, that's going to become more mainstream as universities are trying to open up programs all around the country. And so I think that's going to be, probably the next 5 to 10 years, what's going to be a big part of plastic surgery is going to be gender surgery. And then I think tissue engineering. And so people always talk about, transplants, even with transgender patients. They're like, well, if they want this body part and this patient doesn't want this body part, why don't we just transplant? Well, the
Interesting.
problem with transplant, as you might know, is that
Antibody.
immunosuppression, rejection, being on lifelong medications. So I think what's more realistic is that, we're still decades away from this, but maybe 10, 15 years, 20 years from now, we'll build you the body part, right? If you lost your leg, you lost your foot, you lost a finger, maybe we can grow it in a lab and then send it to you. And then you don't have the donor site and it's basically your tissue.
Nice.
So I think that's going to be part of the future. We're not quite there yet, but I think that's going to be one of the next big things. So
Nice. And
yeah.
my final question as well. I know, like, I'm a huge fan of your work. I love plastic surgery and what you do. What advice do you have for aspiring plastic surgeons? So people want to follow in your footsteps. People want to embrace this noble path.
Yeah. So my best advice is don't be intimidated by the scope of the field. A lot of people don't like plastic surgery because you have to know about every organ system. You have to know the anatomy of every body part head to toe. And I think that's intimidating for a lot of young people, young students. But to me, that's one of the most beautiful things about it. So if you're a fan of anatomy, you'll love plastic surgery. And then also at the same time, know that you don't have to be a master of every aspect of plastic surgery. There's so plastic surgery has craniofacial surgery, hand surgery, cosmetic surgery, breast surgery, gender surgery, burn surgery. I mean, you can find, what you like in your training. For me, I didn't even find, gender surgery until I was years into practice. And so that was one of the beauties of plastic surgery is that I was like, look, I'm going to go into plastic surgery residency because then I can basically put off, picking a specialty until I'm done plastic surgery. And then even when I graduated, I was kind of doing everything, trying to say, hey, do I want to stay like a generalist and do everything? Or maybe I'll find something that I have a passion for. And that's what, the gender surgery became. So,
Nice.
yeah.
Well, I'm incredibly inspired, Dr. Brosious. I mean, I still remain one of your biggest fans in South
Thank
Africa.
you.
I'll keep that title. I want to thank you so much for your time. I know you're busy. You're doing some amazing work, and I hope someday we can meet in the future in the US or even in South Africa. You're always welcome
Yeah.
here. It'll be
Yeah.
lovely.
I've never been, it's on my list. It's on my short list of places to visit is South Africa. So we'll definitely be in touch.
I look forward to that. Thank you. Keep up the incredible work, and until the next one, Dr. Brosious, thank you again so much.
All right. Thank you very much. You have a good evening.
You too.